When caring for clients with dementia, it is essential to remember that we cannot change their condition. Dementia is a group of symptoms that affects memory, normal thinking, communication, and reasoning abilities. These symptoms can make it difficult for our clients to perform simple daily tasks. As caregivers, our role is to support them with compassion and understanding. Cognitive and sensory changes in dementia include memory loss, which is often the first symptom, and difficulty in communication, especially in finding the right words. Clients may have a reduced ability to organize, plan, reason, or solve problems, and may struggle with handling complex tasks. Confusion or disorientation, difficulty with coordination and motor functions, loss of or reduced visual perception, and a metallic taste in the mouth with a decreased sense of smell are also common changes. Psychological changes can include shifts in personality and behavior, depression, anxiety, hallucinations, mood swings, agitation, and apathy. Understanding these changes helps in providing empathetic and effective care. When communicating with clients with dementia, setting a positive mood for interaction is crucial. Your tone, facial expressions, and body language can convey your message more effectively than words. It is important to get the person's attention by limiting distractions and noise, addressing them by name, and identifying yourself. State your message clearly using simple words and sentences, speaking slowly, distinctly, and in a reassuring tone. Listening with your eyes, ears, and heart is essential. Be patient in waiting for the client's reply, and if they struggle to find a word, gently suggest one. When the going gets tough, distract and redirect by changing the subject or environment if the person becomes upset. Respond with affection and reassurance, avoiding trying to convince them they are wrong. Focus on the feelings they are expressing. Remembering the good old days can help the client recall the past, making them feel more secure. Maintaining your sense of humor and using humor in a respectful way can lighten the mood. There are specific behaviors and needs to watch out for in clients with dementia. Wandering is common, so ensure the environment is safe and secure. Be understanding and supportive of incontinence, and have a plan to manage it. Repetitive speech or actions may indicate an underlying need. Try to understand what that might be. Sleeplessness or sundowning can be managed by creating a calming evening routine. Monitor their eating habits to ensure they are getting adequate nutrition, and be patient with bathing routines to make them feel comfortable.
Challenging behaviors, that's how we see it. They're misbehaving. They have problem behaviors. We've got to do something about this. Now, I'm going to call a timeout right now, because the biggest problem we have right here is you've already identified the source of the behavior. You're pretty sure it's them and what they're doing. Timeout. You need to take a step back and realize this is much more complicated than you think. And instead of being such a strong judge and jumping to conclusions, what I want you to do is back off and reframe this. I want you to realize that they're doing the very best they can to try to communicate with you, to meet a need, to express that they aren't liking what you're doing. And unfortunately, you simply see it as not getting your way. What you don't realize is that you started this very frequently in your effort to be helpful. Let me just say to you, you weren't as helpful as you thought you were. I didn't really enjoy the help you gave me. I didn't get it. So you have a choice right now. Are you going to continue to push your agenda to try to get where you want? Or can you take that step back and go, okay, well, this isn't working. Let me rethink. So what you want to do when you experience a behavior you're not liking, you need to, take that step back. Take a deep breath. Let it go, and realize now it's time to kick in the front of your brain and to become a really good detective. Try to figure out what might be driving what you're seeing, what you're hearing, what you're feeling, and what they're feeling. What maybe you're smelling and they're not picking up on, what they're tasting versus what you would be tasting. Because what you want to do is realize that you need to see it from their side. And once you see it from their side, you try to be in their shoes, figure this out. Suddenly, when you see things, hear things, experience things differently, and you make that choice, that decision to do that, the uh-oh becomes an aha, because you can start to realize it's the setting, it's the care, it's the gem. It's who they were before this all started. There's lots of pieces to the puzzle. Your job, if you want to do this well and do this over the course of this condition, is to stop the judgment, time yourself out, and reframe this behavior. Go from a challenging and frustrating, I just don't understand why she's doing this, to pausing for yourself, getting some help, maybe getting somebody else to take a look with you, because maybe you just can't see it because of who you are and how it works. But what you're going to do is take that step back, look more broadly, and at that point, make a decision. What are they trying to do? Are they communicating unmet physical need? There's basically 5 of them you want to learn about. Or an unmet emotional need. Or are you seeing the emotional need, but you're missing the physical need? Or was it something that is happening in the environment or happened earlier today? As I said, complicated. So you need some training. You need to know what's going on and what's not going on so you can quit sitting in judgment and start using this. That's the best tool. That and your ability to bring people together to help you. So with challenging behaviors, it's not about them. It's about us and what we choose to do about this effort to communicate an unmet need and helping us figure out what is the need and how can we better meet it for success for both of us. Making a positive difference because we choose positive approach to the care. Now remember this lady? What do you think she's doing? You see her beating on the chairs, making noise, annoying people, and you know she needs to go to the bathroom. It's been a long time. You've tried to make her stop, but she won't. What if I told you she used to clean houses for a living? I'm going to try substitution and a positive approach rather than trying to make her quit.
Miss Leona. Well, hey there.
Get your hand.
Get my hand out the way. You're trying to get them clean. Here, try this.
She's a busy woman.
There you go.
I'm going to
that.
try a substitution here.
I'll trade you.
Not yet. Show her.
Rub it with that. Can you rub it?
Yeah.
Here, rub
We're
it.
getting there.
Trade me.
Wait.
Trade me. Here you go. Take this.
All right, get it.
You got it. Now trade out. There you go.
Ta-da.
Now rub it.
Now I show her, and there she goes.
There we go.
People
Good.
are less annoyed, not
Perfect.
so much noise. And she's
Beautiful.
cleaning. Now I want to reinforce it. That's
Yeah.
good. That's good.
2 more to go.
But I still haven't met
You're doing a fantastic job.
her unmet need. One more substitution.
Nicely done, Leona.
She needs to get finished with this
Boy, you are good.
so we can move on.
You get this one?
Watch me, I'm sneaky.
That's it. Good. Good.
I visually eliminate the task.
Whoa. Woo. That is beautiful. You did a fantastic job. Man, you're a good cleaner.
Here.
Thank you. All right, well, come with me and we'll sit down and take a break.
Oh, good.
I know you're ready for
I'm
one, aren't you?
tired.
Now,
I don't
before
blame
she
you.
goes to sit
You're
down,
worn
though,
out.
we have a place to go.
Oh, girl, you worked hard.
Oh, good.
You are one of the hardest working women I've ever met.
Yeah. Uh-huh.
Well, Lord knows. Let's go to the ladies before we sit down, though.
Okay.
Okay.
By following these guidelines, we can provide the best care for our clients with dementia, ensuring they feel respected, understood, and supported in their daily lives.